on infectious diseases and what COVID-19 is. I will take you through the slides. Just cue me when you are ready to move between the slides.
Okay, thank you very much, Reagan. First off, I'd like to say thank you to the ABA and to Paul Sir for inviting me to speak tonight. Just as an introduction, again, my name is Dr. Joseph Vialumkal. I'm one of the pediatric infectious disease specialists here in Calgary, and I've been an infectious disease specialist for children since 2005. Just about my background, I'm originally from Hamilton, Ontario. I did my undergraduate degree in McMaster University and my med school there as well, and then came to Calgary to do my postgraduate training in pediatrics and infectious disease. And I also spent 2 years with the Public Health Agency of Canada as a field epidemiologist in outbreak management and outbreak control. And certainly it's an honor for me to be here today because I've been involved in basketball and the basketball community in Ontario and in Alberta about 35 years as a youth player, and then I was lucky in my adult years to do some coaching as well. So I definitely have a vested interest in return to play issues. And Paul asked me tonight to speak about why, as a community here in Alberta, we should be concerned about COVID-19. So I have a few slides. I won't take up too much of your time, just to go over some highlights of some key points. And I do have to sign off at 7:30 for another meeting tonight, so I'll apologize in advance that I'll only be here for the first half an hour. So this is the first slide. I just wanted to highlight this. All of the data that I'll be presenting today is available to the public on the alberta.ca website. And this is the so-called epidemic curve of the COVID-19 outbreak here in Alberta, presented by date. And you've got the case status as well. In the pink color, you've got the confirmed cases, and the blue color, the probable cases. And as you can see, cases started in early May and started ramping up in early April. We peaked at the end of April, and since that time, most of May, we've been doing pretty well. And recently, only, basically between 30 to 40 cases per day coming up over last week. I just lost my presentation there. Oh. So Reagan, you can go to the next slide. Thank you. And so this table highlights the Alberta COVID-19 cases as of yesterday. And as you can see, we have in Alberta about 7,500 cases in total. And Calgary and South Zone were the hardest hit in terms of this epidemic. And that was driven a lot by some of the meat plants outbreaks. And Edmonton zone has been really spared compared to the rest of the province. But as you can see, what I've circled there is that recently, in terms of active cases, in Calgary, about 214, and in Edmonton, 175. So there has been a bit of an uptick in the cases in Edmonton zone recently. Next slide. So this is a summary slide of the severe outcomes in Alberta. And the average age for COVID cases as here in Alberta has been 83 years, those who have passed away, with an age range of 27 years to 105 years. So the probability of severe outcomes certainly is much higher in those over 60. And the average age for COVID cases hospitalized is 60 years of age. And again, in the ICU, being 60 is the average age for an ICU patient, with a range between 15 to 83. The average age of those non-hospitalized is 40 years of age. And next slide. So one of the main messages here is to proceed with caution. We still have a lot to learn about this virus, SARS-CoV-2 as it's called, and COVID-19, the disease. Many times we don't have all the information until many years after a virus has circulated in the community. So it's going to take years for us to really understand this virus and how it affects people in a longer term sense. We are understanding more and more about some emerging syndromes affecting children. Most often young people and children have not been affected very seriously, but over the past couple of months we know of reports of different syndromes that we've seen that can mimic other childhood diseases like Kawasaki disease or toxic shock syndrome that have been seen in children that have had the infection probably a month prior. The other big gap in our knowledge is this whole issue of infected asymptomatic individuals. That is, people who don't have any symptoms but can be infected with the virus. And what's not clear is how much of a role they play in the spread of this virus. We think overall it may be low, but we don't have a perfect idea of how much asymptomatic individuals play a role. And then last but not least, again, we don't have any treatment, and so prevention is the key, and the major tools that we have at our disposal currently for prevention are the measures that have been placed by health authorities across the world and in the government of Alberta in terms of physical distancing measures, emphasis on hand washing, and reducing the amount of large gatherings that take place in the province. So with that, I'll end. Those are only the slides that I wanted to share with you all. So I'll hand it back over to Reagan.
Thank you very much, Dr. Joseph. We really appreciate the expertise. We would now like to turn the time over to Marvin Dobish from SPAR with the Government of Alberta to talk about the document that was released on Friday last week.
Thanks, Reagan. I just wanted to say that before we get started, the sound is really distorted. So if people can turn off their microphones and cameras, we might be able to get a little better signal here, because I could hardly hear Dr. Joseph at all. Can you hear me, Reagan?
Yeah, I can hear you fine. Everyone that is not presenting, please, cameras and microphones off. It eats up the bandwidth and it takes away from the presentation being able to be seen by everyone.
Thanks for that, Reagan. So yeah, I just wanted to say thanks to Paul and Alberta Basketball for the invite to be on this evening's town hall. Just want to thank and acknowledge all the other presenters as well this evening who are giving some time to share some important information with you. It was 1 week ago today that Premier Kenney announced that we would be moving into phase 2 of the Alberta Relaunch, which commenced this past Friday, June the 12th. Many of the sports that I've been working with through the Sport, Physical Activity and Recreation branch, they're taking a really extremely cautious approach to starting up and doing it in a staged approach fashion. I guess, you know, we only have really one good chance to do this, so let's ensure that we do this right. Over the next couple of minutes, I'm going to go over some of the provincial guidelines, highlighting the areas which we believe are most relevant to those of you on the call this evening. Once all of the presentations have been made, I'll be available for some questions. And we'll try to do the best that we can in answering those this evening, but if not, we're prepared to go back and try to find out some of those answers and get back to you in the days ahead. Next slide, Reagan. So in the slide here, I'm showing you the 3 different documents which have been released by the province of Alberta. And these documents have been developed by Alberta Health Services in consultation with some of the members from our Sport, Physical Activity and Recreation branch. I should say that these documents are meant to be guidelines. They're not rules and regulations. So the first document is a general relaunch document for any business or entity. The second one was developed for outdoor recreation in relation to the stage 1 relaunch, which commenced on May the 14th And you'll see that the document has been updated a couple of times since then. And the most recent version of that document is May the 29th. The final document are the current guidelines for sport, physical activity, and recreation, which were released last Friday, June the 12th. And all of these documents are located on alberta.ca BizConnect website. With these documents then, every provincial sport organization is then responsible in consultation with their national sport organizations, if they have one, and their provincial health authorities for developing sport-specific return to play series of documents and to ensure that we have a safe return to sport here in the province of Alberta. Once these guidelines and documents, including waivers, assumption of risks, declarations, screening tools, have been approved by their respective boards of directors, they can then be submitted to our branch and we'll review those documents. Now, I will say that we're not actually approving every sport's plans. We're assessing it, we're providing comments, and we're providing suggestions to ensure that there are no glaring gaps within each sport's plans. Once this has been done, then the Alberta Basketball Association can go through the process of disseminating and communicating out their sport-specific guidelines along with their respective implementation plans. Another thing I just wanted to mention before we go into some of the highlights is that you'll want to ensure that you're working with your facility operators to ensure that your guidelines meet with the approval and that you're able to access a location to return to play. So far, we have yet to see too many published guidelines for the reopening of indoor facilities at this time. Many municipalities have announced that they will not be reopening their indoor facilities until they've had a chance to bring back their staff, educate and train them, and put into place all of their safety protocols so that they can reopen in phases and on a modified basis. We do know that there are some private facilities that have already opened or will be reopening very soon. Next slide, Reagan. Okay, so just a quick overview of the document, and the one that we're referring to is the one that was released on June the 12th. The current medical officer of health orders, businesses and entities are all required to implement practices to minimize the risk of transmission of infection among attendees, to provide procedures for rapid response if the attendee develops symptoms of the illness, ensure that attendees maintain high levels of sanitation and personal hygiene, and to ensure that they're complying to the best possible ability with the general relaunch guidance documents, as I mentioned earlier, that's available on alberta.ca BizConnect. Here's a couple of key points on this slide as we refer to indoor sports and specifically basketball. Transmission of COVID-19 is higher when participating in a close contact sport like basketball. The likelihood of transmission will be higher with indoor sports versus outdoor sports. Shared basketballs between players, coaches, officials have to be cleaned often and should be frequently changed out during drills, competitions, or whatever type of play is being engaged in. As we know, the virus does not enter the body through the skin. It enters through the eyes, nose, or mouth when an individual touches their face. This is why regular hand hygiene, refraining from touching the face, and cleaning of high-touch surfaces like basketballs are so important. And equally important, we have to increase the frequency of cleaning our gymnasium floors to reduce the risk of transmission from shared objects like the ball. Next slide. So there's really two ways within the guidelines that we can return to sport safely. One way is that we can modify the existing sport while following all of the physical distancing rules. Or two, which really applies to our team sports, is that's forming cohorts to a maximum of 50 individuals, including athletes, coaches, officials, volunteers. Now, in discussions with Paul and Jeff and some of the other team members, I think Alberta Basketball will be looking at trying to incorporate elements of both ways. So physical distancing initially, and then forming cohorts at a later date within their return to play guidelines. It's important that as we look to starting back up, that we do so by ensuring that we are practicing physical distancing and good hygiene at all times throughout the process. And I would think that we would want to return with physical training and skill development, since many of our athletes have been off of any type of physical activity or sport for the past 3 months. And then in order for team sport to return once it is safe, we can do so by forming cohorts or mini leagues. So a little bit about the cohorts or the mini leagues. So a cohort is defined as a closed group of no more than 50 individuals who participate in the same sport or activity. These groups of a maximum of 50 can train and play together in a cohort or a mini league. Mini leagues allow for team sports to return to safe levels of play and will help mitigate the risk of widespread transmission by limiting the number of athletes that come within contact to one another. As I said earlier, the cohorts include all personnel that are involved, be it players, coaches, officials, volunteers. They could include scorekeepers. They could include your facility monitors. They could include trainers. So it's up to each individual organization or club to determine who's going to be within their respective cohort. Now, coaches may coach multiple cohorts only if physical distancing is observed within each cohort. So you have to ensure that you're not, getting too close to one another if a coach wants to coach in multiple cohorts. Mini leagues can be comprised of multiple teams to a maximum of 50 people. Within each mini league, gameplay can resume once everybody is ready and you determine who is actually going to be in that cohort. Gameplay between teams must be limited to teams within the same cohort or the mini league. Teams in different mini leagues should not play each other. So within a cohort, you could form potentially 3 or 4 teams. You should only be playing within that respective mini league and not participating against others. Athletes are asked to participate in only one cohort at a time. The duration of the cohort should be through to the end of stage 2, unless the individual is removed from that cohort, and then there would be a 2-week period in which they must sit out before they could change cohorts or join another one. The changing of the cohorts does not require quarantine or isolation. Rather, the individual can't join, as I said, for another 14 days since their last involvement with the previous one. When players are not on the floor, make sure that they're observing physical distancing when possible at all times. So that's while you're on the sidelines and you're out in the foyer areas. It's recommended that mini leagues be supervised by a responsible person whose role is oversight, maintenance of the cohort group, and a liaison with the facility. Groups will want to take a look at daily screening procedures and tracking of participant logs and ensuring that they're keeping at least a minimum of 14 days or 2 weeks of records on hand and following the guidelines. And then it goes without saying, we don't want athletes sharing personal items, towels, water bottles, snacks for the younger age groups. I'd say that, in speaking with Paul and Jeff, that forming cohorts or mini leagues is where we would ideally want to get to at some point during stage 2 rather, if it makes sense for each of you within your respective clubs or organizations. We don't need to rush to get back to this point right off the bat. I think while we're working over the next few weeks to try to get our athletes, back up to some sort of physical conditioning, we can start thinking about who we want to put within our respective cohorts and how we would want to structure, these mini leagues moving forward. This will give Alberta basketball some time to continue to work on their guidelines in consultation with all of their partners, and so that they can safely sanction your respective activities once we're fully back up and running. Next slide, please, Reagan.
Yeah, we're on travel and spectators there for you, Marvin.
That's the last one. That's the last area I kind of wanted to touch on a little bit, because I know that there's going to be some questions about once the cohorts of the mini leagues form and with respect to travel and spectators. So for stage 2 of the relaunch, activities should be restricted to local community opportunities within the same geographical region. So within a respective county, a town, or a quadrant of a city. We want to keep these geographical regions as tight as possible during stage 2 to ensure that we mitigate as best as possible this potential spread of the virus moving forward during this stage 2 phase. Participants should not be seeking sport, physical activity, and recreation opportunities in any other regions or outside of the province during this time. Cross-jurisdictional or interregional play should also not be occurring during this stage. And I guess if people have been asking, you know, what could be the total number of individuals participating in a gymnasium setting? And based on the physical layout and the sizes, we're looking that gymnasiums should not be exceeding 100 participants during this stage. Spectators, excluding parents and guardians where necessary for player support, should be kept out of participant spaces. So that would be off the court and the field of play. The physical distancing of a minimum of 2 meters should be maintained by spectators and attendees at all times, unless from the same household or cohort family. For those of you that are looking at, you know, how many people could be seated as spectators, they're saying up to 100 would be, you know, the guideline at this point in time, ensuring that a distance of 2 meters is maintained between attendees from different households or cohort families through this process. It's recommended that spectators wear masks, especially in an indoor setting, and that cheering and yelling is strongly discouraged at this time as it presents a high risk of spreading droplets within the air. So I'll leave it at that for now. You know, all I would suggest is if you have not had a chance to review these guidelines, please ensure that you become familiar with the entire document, as there's a lot of important information in there as you look to try to, you know, get your respective organizations and clubs back and up and running here. And now I'm going to turn it back to Reagan, and I'll be available later to answer some questions.
Well, thank you very much, Marvin. That was absolutely fantastic. And I think with a lot of the questions that we received beforehand, that it definitely addressed some important issues and gave some excellent clarity on how we need to proceed going forward. We would now like to welcome in Stephen Indig from the Sport Law and Strategy Group, who's going to give us some legal perspective on how COVID-19 is affecting sport and what we need to be aware of going forward. Stephen, the time is yours.
Okay, thanks, Regan. You can hear me? Thumbs up?
Yep, doing good.
Yep. Okay, welcome everybody. Thanks for having me tonight. Like a lot of Dr. Joe said, I too have been an avid basketball enthusiast as a player and an official, and now in a more professional capacity as a lawyer. After graduating law school, I was able to start a sport law practice, and I've been doing so for about 18 years. And obviously, I've spent a lot of time the last couple of weeks talking about COVID and return to play and what that looks like. So I want to talk to everybody here tonight about some of the things that I think is relevant to all of you as you return back to sport. And one of my favorite sayings these days is to hurry up and slow down. And I think you heard Dr. Joseph and Marvin just speak a little bit about, you know, we really have one opportunity to do this, and let's do it correctly. So yes, I'm with you. I want to get back on the court and I want to play. And being even to this day an avid player about 2 days a week in competitive leagues, I'm ready to get back too, but I want to do it safely. And I think we have to make sure we do it slowly and respectfully and correctly. And that's what I wanted to talk about today, is to lay that foundation from a legal perspective as we return back to sport, what the risks are. So the first thing I want to do is take you through 3 years of law school in about 3 minutes and understand the potential liability that comes as we return back to sport with COVID as a potential lawsuit out there. So a claim would be made likely under negligence. You should have done something different to make sure I don't get COVID, or you should have done something better to make sure I don't get COVID. And in order to be negligent, you see those 4 bullet points in front of you, you have to say yes to every one of those questions to be liable. So in sport, do we have a duty of care to our players, to our officials, to our coaches, as organizations or as leagues? And of course, the answer is yes. The second part of the test is, have you breached your standard of care? And this is the one that we have to spend the most attention to. The standard of care in sport is really defined by multiple factors. And if you understand those factors, you can understand why it's so important to go back slowly and carefully. And if we do it correctly, even though somebody may have been injured, and this goes beyond COVID or ascertaining COVID or contagious disease, could be any injury for that matter, if we have complied with our standard of care, we won't be liable. So how do we figure out what that standard of care is? And it's based on 4 principles. It's based on common law. How are the courts decided them? And right now, of course, with COVID, there are no court decisions on COVID. Trends in the industry. So what is we as basketball organizers doing as we return back to sport? So if we're going with a conservative approach, and some of us are going with groups of 5 or groups of 10, social distancing, practice only, and that you can see as a conservative approach, but some of you have gone right to the 50 cohort and started league games, you can see there would be a problem with the trend in the industry. We should be doing this all together, all at the same time, and not only looking at Alberta, but what is Basketball Canada saying? What's happening in BC? What's happening in Saskatchewan? As we look for gaps or holes to say, well, why are you doing things differently? So trends in the industry is really important. And of course, the written regulations. Marvin spoke about the guides that are coming out from the government of Alberta, as well as I'm sure there's stuff going to be coming out from Basketball Alberta as well as Basketball Canada. These issues really start establishing that standard of care. And if you can see my screen, you'll see that I view standard of care as like a line. And if your conduct is above the line, you have done everything remotely possible to create a reasonable, safe environment. And I'm not saying, again, that injury won't occur or someone might not get COVID. But if you can prove that you've been reasonable in managing your return to sport, we can say no to this part of the test, and therefore we wouldn't be liable. So again, trends in the industry, written standards, case law, and the last part is common sense, reasonableness, and gut. What does your gut say? So again, as you go back into sport, you've got to remember those 4 principles to help you establish the standard of care to make sure that you can comply with it. And there's ample case law to suggest that when organizations, particularly sport organizations, do everything they reasonably can to create a safe environment, they will not be liable. And there's a prominent couple cases in the history of sport where, unfortunately, we're talking about paraplegic individuals. They broke their necks during sport. And in one case, a organization was found liable for not providing responsible supervision. And the other case, they were found not liable because they had properly trained and supervised the athlete before they were injured. And the injury actually occurred because of an inherent risk in sport. When we play sport, we assume risk, and I'm going to talk about that in a minute. The third part about the test for negligent is causation. Did our breach cause the damage? So, did you get COVID? Can you prove that it was ascertained at practice, at the basketball environment? If you can't, again, there's no damage. And third of all, there has to be damage. So as Dr. Joseph said, a lot of people getting COVID are asymptomatic. They are not showing symptoms. Their daily lives continue. So what's the damage related to that? And there may be none. And I'm going to come back to that in a minute again as well. So really what I'm trying to say here is, as we go back to sport, we have the ability to control the environment to make it as safe as possible. And why we want to do that is my next bullet point: insurance. Basketball Alberta has confirmed that you do not have insurance liability protection for COVID. So what that means is if your league or Basketball Alberta is sued because someone ascertained COVID, the legal defense fees as well as the possible damage payment are on your own. There is not insurance for that. And I'll be really honest with you, I'm not severely worried about the damage side, because I'm hoping if people do get it, it's likely that they're going to be asymptomatic, maybe show signs of flu or cold. And the damage side of that is, of course, minimal. If they are on a respirator for 3 months, then obviously that's a bigger discussion. So you have to understand, as you go back into sport, there is no risk, there is no insurance for legal fees or defense costs or damages with respect to a COVID claim. So what we want to do, knowing that, is to create the safest environment we can, creating that established standard of care and implementing it. So let's move to the risk management techniques. I have talked about the standard of care. Now I want to talk about the corporate shield. In law, we recognize two things: people and corporations, including not-for-profit corporations, which in Alberta would be called societies. When you become an incorporated entity, you become a legal entity. You can be sued, you can sign contracts, you ascertain the benefits of a person. But what also happens when you incorporate is you ascertain what's called a corporate shield. And anybody within that corporate shield is protected by the corporation, by the society. Directors, officers, staff people, players, people involved are protected by the corporate shield. If you are an unincorporated entity and I want to sue an unincorporated entity, I am suing the people who manage that organization. So those of you who are unincorporated, I would really look at ascertaining that kind of protection. The filing fee for a corporation as a not-for-profit is usually about $150. So you're looking at filing a corporate society to get the corporate shield to protect your personal assets for a couple $100 versus potentially losing your life savings because you have no insurance. I have nobody else to sue other than the organizers of an unincorporated entity. And sometimes people don't sue to be vindictive. Sometimes people sue by necessity. So God forbid somebody becomes a paraplegic that can't work. They have 2 kids at home, as well as a mortgage payment, a car payment, and children to put through university. How are they going to do that? They are going to have to sue someone to try and get those funds. So sometimes it's done by necessity, not by vengeance. So I really would advocate that those of you who are unincorporated to look and establish that corporate shield. Yes, there are some administrative responsibilities that come with that, like having bylaws, like filing likely a tax return, like filing some corporate documents with the Register of Societies in Alberta. But in my opinion, it's so worth the alternative of being personally liable. My wife runs a softball league. It started off with four teams, 40 people. And the first thing we did was incorporate because I wasn't prepared to lose our house over a 4-person softball league. Now it's grown over the years and we have about 400 people in the league now. And that makes it even more viable. I spoke to a client the other day. He has a league of 250 softball teams, and they're unincorporated in a $500,000 business. In my opinion, it's definitely not worth it to ascertain that corporate protection, that corporate shield to protect you from your assets. And again, because there is no insurance on COVID. Other things, as Marvin spoke about with return to play, would be waivers, assumption of risk, declarations of compliance. So I'm a big advocate for them, but I want to give you a little bit of understanding about them. A waiver is basically a document that does 2 things. It describes the risks associated with a sport. So come play basketball and you might roll an ankle, you might catch a ball in the back of the head, you might fall over, you might run into another guy taking a charge or a block or things that we assume by playing basketball. The other side of risk in sport is what we call the legal risk. And that's what I had described at the beginning of my session would be negligence. A waiver basically says, hey, come play basketball. You might get hurt playing the game of basketball, or you might get hurt because we should have done something a little bit differently, and you can't sue us. So you can see the ethical debate of it there, first and foremost, but from a risk management perspective, it's brilliant for the organization. Now, people call me all the time, I need a foolproof waiver, and absolutely there's no such thing as a foolproof waiver. What it is a risk management technique that you can use to use as a counter defense to a claim. So Reagan, I'm going to pick on you. I can see your face. You sue Edmonton basketball for something that happened, and Edmonton basketball says, no, Your Honor, Reagan signed a waiver. Here it is. He agreed he wouldn't sue us. And the judge may say, you're absolutely right, case dismissed. Or he may say, or she may say, I don't care, I want to hear the case. But the enforceability of a waiver is very much accurate. There's ample case law to say they are worth the paper they're written on. If executed properly, if executed in a timely manner, you actually have a copy of it and you can present it. And when we talk about execution, we would like to have a signature. We would like to have a witness. A lot of people may be going to online registration. The A standard for online registration is a distinctive signature, not a checkbox, not a type my name, but a distinctive signature. Maybe they can do it with a mouse, or they can upload, electronic signature. If you can't do that, then obviously you're going to have a little bit of a weaker enforceability of a waiver. So if you can do that, do it. Don't feel you have to keep the paper forms, scan them, keep them on a hard drive. These are the 2020 waivers. What we've been doing in our shop lately is updating the normal standard waiver to include COVID clauses about contagious diseases and explaining that risk as they come back to sport. The other kicker with respect to waivers is a big one. Waivers are not enforceable against kids, and nor can their parents sign them on behalf of a kid. A kid can only sign a document or a contract that is of a benefit to them. So saying to an organization, when I'm hurt, I can't sue you, is not a benefit. Therefore, it's not legally enforceable. So what we like to do is we like to distinguish between, again, the risks of sport and the waiver of I agree not to sue you. So when we do the assumption of risk, we describe all the risks associated with basketball, including COVID, but we don't ask for the liability exemption because it won't be enforceable. So we always have two documents, one for adults, one for kids, and again, keep them. So the third document is the Declaration of Compliance. Do it as often as you can. And again, it's those questions that you see routinely these days. Do you have a fever? Are you showing symptoms? Have you been around anybody with COVID? If you are, you'll tell us and you will disclose that. So do those as often as you can. Some organizations are implementing them at every event. But again, I would ask you to emphasize or to consider the legal side versus the reality side of the administrative burden. The more often, the better from a legal perspective, but you'll figure that out from what you can and cannot do. Super important to also do the attendance tracker to know who may be exposed in that cohort. The last thing I'll talk about is litigation, and that's where some sports have really made the decision they're not going back. They're not prepared to take the risk of COVID without insurance. A couple things to consider. Most personal injury lawyers work on contingency fee, and what that means is they take a percentage of the winnings. So if I sue Reagan and I win 100 grand, my lawyer's taking 30,000 of that, and that's how he gets paid. If there's no insurance policy to actually make the payment, there's really no money to be had. The lawyer may not agree to take the case on contingency and is now looking to be paid $300 to $600 an hour to file the claim. So some people may not be interested in paying that kind of money. And as I spoke before, two things that have to happen. They have to prove we have a duty. They have to prove we breached our standard. They have to prove we caused COVID. And I think that's really challenging. Regan, have you been to the grocery store today? Yes. Regan, have you been to the bank today? Yes. Regan, did you fill your car up with gas? Yes. How can you be sure you got COVID at basketball practice tonight? Now, if there's a breakout and everybody who showed up has it, then that's a different conversation. But again, we're going to go glass half full here. So to prove causation is going to be a challenge. And the last part, of course, is we hope even though they do get it, the damage to their health is minimal and there may not be anything there. So with all those really scareful tactics that I'm talking about here, people have asked my opinion. Should we go back to sport? I say absolutely yes, we should. I think waiting for a vaccine, which could be 6 months or 6 years, I don't think our society can wait to not have sport. but I do want you guys to hurry up and slow down and do it slowly, do it cautiously, do it so you can implement that standard of care to go back safely and to let people make informed decisions as we do that. You guys may have heard that BC's government actually outlawed litigation claims against sport organizations in BC. Which is true, and I wish that would happen across the country. We'd have to lobby each provincial association government to do that. But even in BC, it's restricted to the time that they're under emergency declaration, which I believe, if again, don't quote me on this, but I believe in BC ends in a couple weeks. So they do have that caveat. If our governments step up and make that recommendation, I think that would be fabulous. But again, full circle. Use your waivers, use your assumption of risk documents, use your declarations, go back slowly, be fully aware of what's in those return to play protocols from Alberta Basketball, from Canada Basketball, from the government. Because again, from a litigation perspective, hey, Reagan, it says here in the government, in the regulations, no more than groups of X. Why did you have more? You know, and your answer is probably not going to be a good one. And that's when we say you get your checkbook out. So really important to follow those guidelines. I will stop there. I will stay on the line, of course, to answer questions as they come about. But, you know, I'm excited to get back to basketball too, but I think we have to make sure it's done appropriately. So thanks, Reagan, and I'll stay on the line.
Stephen, thank you very much. That was insightful and well articulated. And I think it hits on so many of the key things that we need to be considering as we make our return to basketball. Again, us too, we want to be back out there and doing it the right way, as you've stated, is so important. So again, thank you very much, Stephen. Next, we would like to welcome in Ron Young, Director of Domestic Development from Canada Basketball. Ron has been working extensively on the return to play documents from the National Sport Organization, and we are excited to have Ron with us. Ron, the time is yours.
Perfect. Thanks, Reagan. You can hear me okay?
Yeah, we can hear you.
Perfect. Thanks for having me. Really appreciate this platform to be able to speak a little bit on the work that Canada Basketball has done to put a document and resource together with regards to back to basketball. Most of the work that we have done, you know, I wouldn't say it's solely created by us. We've done a lot of best practices with other federations across the world, around the world. We have looked at various resources from other sports, but more specifically, we've been leaning a lot towards FIBA Restart Guidelines for national federations, as well as the work that the COC and OTP has done with regards to all of their resources in terms of guidelines for return to sport. Through all of those type of resources, we were able to work with what we created our own task force, in which we are incorporated 13 people, 5 of which are doctors, and others are IST managers, as well as high performance directors of both men's and women's national teams, as well as Wheelchair Basketball Canada were involved in this project as well. So the work that has been created is, funny enough, has been circulated as of this morning. So we are very excited to put that out into the community. We have shared that via our membership group as well. It is now publicly available on our website at basketball.ca. So the Back to Basketball document really is establishing requirements to create a safe environment to protect families, communities, organizers, while allowing the resumption of training and participation in basketball-related activities. I just want to make a note that it is not a single document that is going to tell you what to do. You know, as organizers, as club presidents and executives, it is still your responsibility to consult with the local and provincial government health officials, as well as Alberta Basketball, and to use this document to complement in a way to make and plan your, you know, specific considerations that is catered to your own needs and circumstances as well. We've broken down a lot of the work into sections. We've dug into a bit on facility recommendations, the stuff that entering facility, assessing the court, cleaning, disposing methods. I think some of that stuff are pretty, you know, out there in the community, not specific to basketball, but in general. But we've tailored a lot of that specific information to basketball itself. We go into participant safety that talks about the symptoms of isolation and reporting, personal hygiene and items, physical distancing measures, as well as spectators. And we talked about the time to train, which is general recommendations for returning to training, the training monitoring, as well as training volume, intensity, and progressions that is related to sort of the participants coming back into the sport. The main piece of this document really goes into sort of the phases as we try to lay out a phase-by-phase approach on returning to basketball. Just like how there are various phases of returning to physical activities, we made a very specific basketball phases broken down into 5 different phases. Phase 1 being education and individual training begins. Phase 2 being individual training continues and begins small group training. Phase 3 goes into whole team split, training sessions begin, and then internal 3-on-3 competitions permitted. Phase 4 being whole team training sessions, internal team 5-on-5 competition permitted, and phase 5 being whole team training sessions, local competition resumes. This is what we have done to really lay out the phases in which basketball should come back into the community. I do want to make a note that within this version 1.0 document that we just released as of this morning, the phases that we are recommending and fully fleshed out at the moment is really just phase 1 and 2. We have not fleshed out the phase 3, 4, and 5 as it relates to anything to do with competition at the moment. It is recommended by Sport Canada and as well as COC in terms of this information and as it relates to competition should come at a later version 2.0 document, as no province at the moment is really ready to step out of phase 2 from this sport perspective. And so that's what we have done in terms of building out our back to basketball phases. So really at this time, most of the recommendations is on voluntary, individual, and small group training. And again, the competition piece is something that we are very cautious in terms of getting into as you know.
Hey, Ron, your audio is cut out there, man. Ron, are you still there with us? Your audio, your microphone has gone off. Ron's just resetting. Ron will be back on in a second here. Again, just a reminder, if anyone has questions that you'd like to submit, info@basketballalberta.ca, and then we're collecting those questions, and then we will address any that haven't been adequately addressed throughout the presentation. So appreciate you sending the questions in. And again, info@basketballalberta to address the questions. Just while we wait for Ron, though, I'll tackle a couple of them that we can now. We had one question about Team Alberta potentially resuming or choosing teams with the cancellation of nationals that were supposed to take place in August. We will not be making final selections for Team Alberta. Again, as the opportunities to return to training come out, we will again explore opportunities to potentially have these athletes do some training, but there won't be any final selection for for our Alberta teams this summer. We had one more question about the resumption of NCCP courses. Yes, we will be resuming those. Again, careful planning and making sure that everything's in place and finding appropriate facilities to do that. But we are planning to resume the resume NCCP courses as soon as we are able to, which is in the immediate future.
I am back.
All right, Ron. Time is over. Time is yours again. Thanks, buddy.
I don't even. I felt like I kept talking and I didn't realize I was even dropped off from the call.
Sorry, Ron. Can you repeat that?
I was saying I don't even know where I left off. I sort of kept talking. I just didn't even know when I was off.
Yeah, just jump back. You were talking about the development of phases and then what the recommendations currently are from COC, Sport Canada, and where we're at again in developing the phases of return to play.
Okay. So have I actually gone through all the phases?
You've talked about 1 and 2, and then how 3, 4, and 5 are not yet.
Perfect.
Not yet there.
Okay. So sorry, guys. Really apologize about that. I try to turn off my camera just to make sure that I have the bandwidth here. I really want to just jump back in really quickly, and I won't take too much time. Really for us right now is to focus on the phase 1 and 2. The competition phases of 3, 4, and 5 is something that we are currently working on and developing in version 2.0. We don't foresee this to be too far away at the moment, but it is something that we are taking very careful approach and very cautious in terms of how we go about getting back into presenting the competition phases. We want to do it correctly and to get back to sports safely, and we want to do it the right way. And we want to make sure that we've done all the precautionary measures to make sure that this is fully flushed out and that all of this pieces that we are presenting to the community is going to be very important and instrumental towards everybody's safe return to the sport. The document, again, is on basketball.ca. Now publicly available, the version 1.0. Within the document, there are many links and that links to various resources. There are also a lot of appendices that are built out. I know from a legal standpoint, we've also worked with, I know Stephen talked about the various waivers of liability and all of that. From our end, we have been working with COC's legal counsel, Faskin, with which we have various event participation waiver, daily attestation form, facility waiver, remote training waiver that we have made available for participants, organizers, as well as club president and all of those to use as well. So I'll leave it at that. Again, this is available for resources as well as for referencing with your own. And feel free to go in there and make sure that you do review the various requirements and protocols carefully, and then use it to your advantage, as well as partnering that and complementing that with both Alberta basketball as well as your provincial recommendations as well. That is that from my end.
Ron, thank you very much. It's getting late for Ron coming to us from the Greater Toronto area. So Ron, we really appreciate you staying up late with us tonight and giving us the time. We will make sure that the Back to Basketball document from Canada Basketball is easily accessible through our website at albertaab.basketball.ca as well. So again, Ron, thank you very much. Appreciate your time.
Thank you.
We will now welcome in Perry Stothert, president of the Alberta Basketball Officials Association, to give us an update on where the officials are at with return to play. Perry, the time is yours.
Yeah, thanks, Reagan. Appreciate the opportunity to spend some time with you this evening, everybody. I won't take a lot of your time. I know that incorporating sort of an official's perspective in a collaborative kind of mindset is what this purpose is. And we have had some discussions at a national level and with varying provincial organizations. A couple things I'd like to say. Obviously, we're all lovers of basketball, and I'm definitely encouraged by the point where we seem to be moving to, where we can have this type of meeting and discuss sort of the next steps. And I see, obviously, as officials, we have a role to play in participating in those guidelines. much like the guidelines that have been outlined in terms of, sanitation practices and different things like that. Those are all things that, are easily, easily formed into habits and things like that when we talk about, safe participation, not only for the officials, but for everybody participating in the games. As officials, it's a little bit of a different dynamic for us because, traditionally, even our position on the floor, we tend to be standing away. We're not, in physical contact like the players will be. We're not as tight as maybe coaches would be in a normal bench or coaching setting. So I think a lot of the protocols that we're developing or will develop, will be pretty easy. There's kind of this return to training aspect versus the return to competition. The return to competition is what's really going to bring the officials back in. I do think that, so a couple thoughts I have, and it's really important to understand, again, as we collaborate and develop these guidelines, is that as basketball officials, our role to play in participating is to referee the basketball game. And there's going to be a lot of extra protocols and things in place related to COVID for all the participants and officials included, showering at home and those kinds of things. But our role isn't really going to be to facilitate following those COVID protocols. As officials, our officials are trained to be on the basketball floor and providing an environment where the kids can enjoy participation in sport. But the elements and systems that are going to get developed need to be able to operate on their own and be managed by the participants. For example, as officials, it's not going to be a role to make sure that every player on the bench has their own water bottle or they sanitize their hands before they come in. And so I think we need to keep that in mind, that the systems that we do develop, for safe providing the safe return to sport for everybody kind of keeps that in mind. And, I think as a general, thought, we're all excited about the opportunity to get back to it. And like anything, the participants, coaches, parents, as officials, we're all going to have a decision to make when we can, again, as Stephen said, sort of speed up and slow down, do everything right so we can participate. And we're all going to have a personal decision on what our level of acceptable risk is to get back to it. And I'm looking forward to it happening sooner rather than later. Frankly, like many of you, I'm probably spending way too much time at home right now, and it's not something my wife signed up for. So she's ready for me to get out of the house a little bit more, and hopefully we can get things moving in the right direction. And definitely encouraged being here in Alberta. Having the numbers that we do and the positive movement in COVID is really going to help facilitate a lot of this, I think, and the facilities that we have. And so I look forward to that as well. Thanks.
All right. Thank you very much, Barry. Appreciate it. We'd now like to turn the time over to Jeff Bailey from Alberta Basketball, who's going to take us through some specifics of how our Alberta Basketball Phase 1 return to play is going to look. Jeff, time is yours, buddy.
Thanks, Reagan. Before I go, I'd like to just say a sincere thank you to all of the other panelists who have been on sharing their expertise with everyone this evening. In some cases from far reaching across the country and staying up late to be a part of this, but it's hopefully, I believe it's very critical information and it's appreciated by everyone that's part of this call. So thank you. I want to touch on the return to basketball plan for the Alberta Basketball Association in Alberta. And it was outlined in the documents shared today from Canada Basketball, and for our sport of basketball, we really see our position right now is we're at stage 1, which is return to train. At the forefront is the safety of all of those who are participants, and that includes the athletes on the court, our coaches, our volunteers, admin, everyone that would be considered to be a part of our individual work, our clubs, and our organizations. It's really important that everyone realizes, as anxious as everyone is to get started, restarting is not mandatory. Each individual club and organization will have to do an assessment to decide for themselves if it's appropriate now or when to restart their operations and activities. And individuals, clubs, and organizations are encouraged to complete the club risk assessment and club mitigation checklist tool to create a plan that considers unique needs and circumstances. Now, this is a link that will be available both through the Canada Basketball document as well as online. We'll likely have it posted as of tomorrow morning. This is a document that comes from the COC on the podium to help clubs with their own risk assessment. Reagan, move to the next slide, please. So some guidelines, and again, it's been stressed several times on this call, and we want to make sure that it's clear. Like, these are guidelines highly recommended that are followed. Physical distancing, it remains the constant through all of the modifications and adjustments that have been shared from the government and through all the different sporting authorities. Participants should always maintain the 2 meters of physical distancing. Unnecessary physical contact, such as high fives, handshakes, fist bumps, hugs, chest bumps, etc., it's still prohibited at this stage. Personal hygiene that should be considered. Participants must clean their hands with a hand sanitizer upon the following: entering a facility, entering or exiting the court, during all breaks in play, such as breaks for water, breaks for rest, breaks for instruction, and from departure from the facility, furthermore, before getting into their vehicle and before heading home. One of the things in consultation with facilities is locker room access at most facilities, when permitted, may be restricted or not available at all. So participants should be considering using the washroom at home prior to arriving, and they should be arriving changed and ready to go to, again, help with the physical distancing and to deal with the circumstances of facility access when they get there. Spectators are prohibited except for those who are providing care to children under the age of 12 or for those persons in need of direct personal care. So that would include our youth age groups under the age of 12 and anyone who has a physical impairment or injury or requires special attention. Reagan? Equipment during this stage, participants should be bringing their own equipment, such as basketballs, water bottles. Strongly suggested that they fill it at home for the same facility considerations of not having access to a water fountain. Should be bringing their own towel, sanitization products, and any necessary medical supplies. Unnecessary non-basketball related personal items, such as a cell phone, for example, should be left outside or in a personal bag in the facility or in the place of play. The area where these personal bags are located should be disinfected regularly in between use. Any equipment should be disinfected before and after use, and as frequent as possible during the actual use of the equipment. It's recommended that you do not share equipment at this time, and that athletes and participants involved in particular limit the hand touching of their face, as well as other parts of their uniform on the play, such as their wristbands, headbands, jersey. Again, this is all about trace and all about how potentially this virus could be transmitted, and that's through droplets. Participants at this stage, participation is voluntary, so no one should feel compelled or forced or coerced into having to participate if they are not of free will and wanting to do so at this time. Another link that will be provided is the COVID symptom self-assessment tool. This is actually provided by AHS from the Alberta Health Services. It's recommended that participants would stay home if they have been diagnosed with COVID-19, have symptoms of COVID-19, even if mild. If you have come into contact with a suspected or probable case of COVID-19, you have been told by Alberta Health Services that you may have been exposed to COVID-19, or you have returned from travel outside of Canada and are currently experiencing symptoms of COVID-19. Some considerations for organizations at this time. Organizations must be taking full attendance. Participants should be pre-registered to help with this, with attendance and with compliance for organizations. A waiver form should be signed by the family of those participating. So it should be specific to your activity or event, and it should be including an acknowledgement or a statement regarding the COVID-19 and communicable diseases. Our waivers, and they've been provided by Canada Basketball at this point, and we will have those uploaded as well. They should be modified to be including this information at this point. Assigned daily attestation. Participants should be signing a daily attestation confirming that they do not knowingly have COVID-19 or its symptoms, have not knowingly been exposed to COVID-19 during the last 14 days, or frequented any areas or individuals at a higher risk of exposure to the virus. Now, during this stage, a daily attestation, that doesn't necessarily mean Monday, Tuesday, Wednesday, 5 days a week. It could be once every week or however often these training activities are taking place. You should have complete contact information for every participant who's participating in the activity or event that you are hosting. And you will be required to maintain these records for 2 weeks to provide information in particular to AHS in the event of contact tracing. And this is really important from the perspective that if there is anyone that is suspected of or is diagnosed as having COVID-19, they're going to be required to be able to trace everyone who may have come into contact with them. And if that is within the training activity they were involved in, that's where they will look for this information. And finally, just getting back to the beginning, be taking every precaution possible to ensure the physical distancing of 2 meters is being followed at all times. Reagan? So phase 1 entails predominantly individual skill work. Sessions should be a maximum of 45 minutes to an hour per session. It's encouraged in the beginning. These are scheduled closer to the lower range of 45 minutes to gradually build up an athlete's fitness level. There should be no sharing of equipment. Follow the one rule: one player, one ball, one basket, no passing between anyone. Non-contact training during this stage. Physical distancing, 2 meters, 6 feet. Measures should be maintained. Should be adhering to local public gathering restrictions. Consistent training groups to allow for contact tracing. And I'll go to the second point, which is public gathering restrictions. If greater than 5 and the court has 6 baskets, at this stage, only 6 players plus 1 coach at the center should be participating. There's no competition. Individual shooting, dribbling challenges at own baskets are permitted. Players must retrieve their own basketball or use alternative methods. It's recommended that they are avoiding the touching with hands in their face and using their feet to return basketballs to fellow players. There's no spectators on the court or on the playing surface recommended or permitted at this time. Essentially, the language that's being used is no non-essential participants should be on the court. A reminder, the maximum number in this phase is restricted to 1 player per basket with 1 coach supervising, and that maintaining physical distance is an adherence. Reagan? Now, of special note, Alberta Basketball is currently reviewing those recently released guidelines from the Alberta government to assess further modifications to the return to basketball guidelines for stage 2. Once this has been completed, the documents will be shared with the ABA Board of Directors for approval prior to being sent to Canada Basketball and the Government of Alberta for final sign-off and approval. And one of the questions that has come up, and it's appropriate to answer here, Alberta Basketball will be sanctioning and applying insurance coverage towards all basketball activities organized by our members, member organizations in good standing that take place indoor or outdoor at this time, so long as they are in accordance with the phase 1 return to basketball guidelines. Some of the questions that have come up at this time is access to facilities, and it's been mentioned on this call, and as people are likely finding out for themselves as they're reaching out, facilities are not quite ready to reopen at this time. But what we can suggest and can happen is moving, and it's in the documentation, to modify to move our training or activities outdoors. And the question that has been raised is the coverages will be in place to cover your activities if you do take that to an outdoor court, so long as you are following the guidelines at this time. Thanks, Reagan.
All right. Anything else, Jeff?
No,
Before I start throwing questions at you?
No, that's it at this time. I do want to, again, thank everyone for being on here. I really, really do hear to the words that, Stephen mentioned earlier, and I know it's been said a couple of times on this call, that, we need to hurry up to slow down here, and just make sure that we have our processes in order, and that we are really looking to protect and keep the safety at the forefront of those who are participating on the court. Thank you for everyone taking the time to be on this call.
Okay, we will jump to the Q&A now, and then we will allow Paul to finish up after we're done the Q&A. So thank you to everyone who has submitted questions to us here. Again, a lot of them lot of similar tones throughout the question. So we'll try and we've tried to bundle the questions so that it's kind of one question that's answering about 10 of the submissions, to be honest. First one, Jeff, we'll have you address this one. Men's basketball, and in particular, I know it's an Edmonton-related question. Does this fall under Alberta basketball, and when will this potentially happen for men's league?
Sorry, Reagan, the question cut out.
Sorry. Men's league basketball in Edmonton in particular,
Yep.
does this fall under Alberta basketball, and will it happen for the fall?
It's a great question. As of right now, that would be a return to competition. That also would rely on a couple of other factors, such as facility access and whatnot. Right now, we're in stage 1 of the return to play guidelines, and we should have updates in the coming weeks as we move forward.
Perfect. Thanks, Jeff. Another one to send your way, Jeff. Comparing the Canada basketball and our Alberta basketball guidelines, which guidelines are we following? Provincial government and Alberta basketball or Canada basketball ones? And again, the matching up of the two policies that we've received.
Sure. Great question. With receiving the Canada basketball guidelines, Alberta basketball is going to be aligning with the NSO model, the National Sport Organization. As stated, we will be reviewing the recently released documents from the Alberta government to see what modifications could perhaps be made to the return to sport document, in particular for Alberta at this time. But right now we're in the stage 1 phase in alignment with Canada basketball.
Perfect. Thanks, Jeff. Marvin, are you there? Okay. A question
go ahead,
as it
Reagan.
relates to cohorts and distance. So our club team is composed of rural Alberta players from Hanna, Red Deer, and Camrose. In this case, because we would use Hanna as our practice area, Camrose schools are not allowing anyone in until August. Would we be required to find other organizations in that area to form a cohort?
Well, the definition of cohorts and geographical region is within the document. So I think as best as possible is if we can try to limit those cohorts to, a single town or a small region. That's what's being suggested at this point in time. This question has come up from a lot of sports in the rural areas, and we're trying to get some more clarification from Alberta Health Services as to the formal definition of a region. But I know yesterday we were asked the question by baseball, could their cohorts be formed, zone level? And we said absolutely no. The zones, the 8 geographical zones, that's definitely too large an area. So why don't we take this one back again to Alberta Health Services and see if we can get a little more clarity on that one, Reagan.
Sounds good. Thanks, Marvin. Okay. Again, Marvin or Jeff, you could probably tackle this one. It was mentioned that players are asked to participate in cohorts if they wish to play non-socially distanced basketball. Is it optional or required to officially join a cohort? It seems that there should be some formality to the process of joining a cohort. Comments or answers to that, Marvin, Jeff?
I'll start with that one. I would think that, the formal process should be established by the respective organizer of that, cohort or that team. And so if that's going to be a club president or somebody assigned to a respective age group or gender, then it would be their responsibility to come up with what the cohort is going to look like in terms of, the rules and regulations of who's going to be allowed to participate or not. And then I'll just throw it over to Jeff for further comment.
Thanks, Marvin. I would agree with what Marvin has said. It's really going to come down to that organization, or as the documents state, that person who's going to be in a position of authority overseeing the guidance of the cohort itself to set that establishing of the cohort and who's going to be a part of it. One of the things that I know, one of the questions on here, and I'm getting ahead of probably you, Reagan, on it, and I apologize. There's a question on here about the participation in multiple cohorts, in particular across multiple sports. And the guidance that's been given by Dr. Hinshaw on this in particular, and Marvin, you can attest to this, I hope, is that our sport is considered a contact sport, a team sport. And if you have players who are participating in multi-sport, which we all vehemently agree with, unfortunately now is not the time that they're able to do that, in particular with cohorts. So if you have, I think the question in particular was about a young person who played soccer as well. Unfortunately, at this time, they would not be permitted to play in both cohorts, basketball and soccer. They could do individual sport, but they couldn't do two team sports or two contact sports. Am I accurate in that, Marvin?
Yeah, that's right. And I think just even to break that down a little bit further, it came out last week in our conversations with the sport of soccer, whether or not an individual athlete could participate in their club program, but then also participated in an academy program. So we said no, they have to choose one cohort group at this point in time. If they choose that they want to remove themselves and then join another cohort, because if there's another opportunity down the road, then they would have to remove themselves for a period of 14 days before they could join a different cohort. But only one at this point in time within a sport, or if it's a two-sport athlete, they need to choose one for the foreseeable future during stage 2.
Thanks, Marvin. Jeff, anything else on that topic?
Nope, not at this time.
Okay. Stephen, are you there? A question for you.
I'm coming.
Thanks, Stephen.
Go ahead.
Okay, I'll read this off to you, and then you can give your opinion. We have a corporation that we operate our business in. In the past, we have run, coached, sponsored a few spring club teams. It's a 0% profit with the club. We end up investing in the team. In your opinion, do we recommend that we set up another corporate society to run our club teams through? You are correct. The incorporation is not costly, but the annual tax return accounting fees would be prohibitive to go this route.
Yeah, a great question. I think you don't necessarily need multiple corporations or multiple societies to run, every team. You just have to make sure that the club or the team that you want to include in your corporate shield, as a friend of mine likes to say, if it looks like a duck, acts like a duck, it is a duck. So, have some sort of recognition that that team falls under the corporate society. And I don't think you need a standalone entity. I think it would be crazy. This came up on a call we did with soccer last week about, there's, particularly in a men's league, there's 80 teams. Does every team need to be incorporated? The answer, of course, is no. They do have to fall under the auspices of the league or the club. So I don't think you need a separate entity for each team.
Thanks, Stephen. Appreciate it. This will be another one for Jeff and Marvin in particular. Again, as it relates to competition within the cohort. If a club can clearly demonstrate that they have measures in place in accordance with AHS, Alberta guidelines and orders, can they be allowed to form their cohort bubble of up to 50 people and return to play?
I'll let Marvin touch on that one.
Well, I think at this point in time, basketball, or Alberta basketball's outlined what their phase 1 return to play is. So I think, we need to take some of this discussion offline and regroup to determine whether or not, we're going to allow cohorts to, formulate during phase 1. So I think that, once we have some additional discussion, I would suggest that, we can be in a place to return, get back to you. But I will share with you that other sports are also facing the same situation right now, and they're not allowing their cohorts to form immediately. What they're doing is they're taking the next couple of weeks here before the end of June and trying to focus on, fitness, physical training, doing some skill development, and then start looking at the formulation of those cohorts in which they would then bring them together, at some time those first couple of weeks of July. So taking a really slow, cautious approach and ensuring that everything is working out accordingly before we really jump back into this which is what I know most people want to do, but we can't do that right now would be, you know, the suggestion that I would bring forward at this point in time.
Okay, and Paul, you're going to jump in here as well to provide some context. Paul, are you there?
My apologies. I want to just build on what Marvin said. We want to go very slowly out of the gate. That doesn't mean we want to slow down the progression or the building towards returning to competition, but we know it's extremely important to stay within the guidelines and standards of other sports, of our NSO, and also get clarification that, because there are a number of other areas of the cohort formation that we want to have further discussions. One of those, and Marvin, we'll talk about this online, but several people have asked me, within large metropolitan areas where traditionally basketball clubs and organizations have drawn young players from all over the city to come in and have always played together. Now, according to the letter of what the Alberta regulations or the Alberta Health Service regulations are saying, they shouldn't be able to do that. But we want to submit to the government what this may look like, and that's going to take some time. So at this point, we're not looking for cohorts to be formed or to compete in practice in large numbers. We're going to stick with the phase 1 guidelines. We're looking very seriously at the phase 2 guidelines. We're going to go to our board real quickly, Canada Basketball, Government of Alberta, and then move this forward.
Perfect. Thank you, Paul. Question regarding just when we are actually back in a facility, any indication of what will need to be done to clean gym floors, how often, products, and things, the safe things to use on cleaning a basketball. Jeff, Marvin, anybody that would like to speak to that?
Yeah, I think, Reagan, at this point in time, I think that's going to be up to each respective facility. As I mentioned earlier during my presentation, we have yet to see really any specific guidelines coming out from any of the indoor facilities at this point in time. So I know municipalities are trying in some regard to get their facilities, back up and running, but much like everyone else, it's going to take some time so that they can put in all of their proper protocols and procedures, educate their staff. So what we can do is we're trying to get some information right now to be standards in terms of what those cleaning protocols will look like, but it's a little bit early at this point in time, and we'll have to do some more research and work on that one and get back to everybody.
Perfect. Thanks, Marvin. Appreciate it. Okay, just another clarification. So Jeff, phase 2 guidelines, again, just walk us through what we're looking at to work towards the phase 2 guidelines being released.
So as far as phase 2 goes, Reagan, we're currently going to be reviewing those guidelines and looking at them and how they can be further modified to our phase 1 documents, putting forward those modifications to our board of directors, and then once that's approved, it'll go to Canada Basketball and the provincial government of Alberta for approval, and we'll be sharing that. And as Paul mentioned, we're looking to do that in as reasonably quick turnaround as possible. We just, again, as it's been stated, we get one shot at restarting this, and we want to make sure we take the diligent time to do so that we can enter phase 2 appropriately.
Okay. Thank you, Jeff. And just one more for you, Jeff, to close up the question period. Just again, sure. Clarification on what ABA members can expect from an insurance perspective from Alberta Basketball. So what, based on what we are presenting from our phase 1 return to play, what kind of basketball activities will be insured?
Sure. So right now in phase 1, it's based on individual skill training. So the one rule of one player, one ball, one hoop, one coach supervising. in the insurance coverage, the accidental liability, injury liability, all of those standard insurance coverages will be applicable. What doesn't exist, what isn't there, is any coverage whatsoever for communicable diseases such as COVID-19. And at this time, that's in phase 1. We're in individual skill training and training, return to train right now.
Okay, so anything related to competition will not be insured, correct?
Not at this stage.
Okay. All right. Well, thank you everyone for the questions. We really appreciate taking the time to submit them. We'd now like to turn the time over to Paul Sir, our Executive Director, to close out the meeting this evening.
Thank you for that, Reagan. I will echo what others have said in terms of thanking our presenters for what we hope will be a comprehensive understanding about the COVID-19 pandemic challenges that we've all faced, and now with the government of Alberta coming out in conjunction with Alberta Health Services, giving us these broad guidelines to get moving again. We're grateful for this opportunity, but I don't want to continue to repeat what's already been stated so well, but we are looking to build back into the game and make sure our alignment in building back in is consistent with putting best practices into place, so that we are taking advantage of this opportunity to go slowly, go forward sensibly, and go forward safely. We have a lot to work on, but we're working on it in an extremely aggressive fashion. As Jeff indicated, we're working real hard on the phase 2 part of this. We have a board meeting coming up shortly. We anticipate to be moving into phase 2 as soon as we can, and by that I mean hopefully next week. At some point we'll be able to go into phase 2, and then we'll be starting the process of reviewing other ways to move forward. But we want to ensure that the right guidelines are put into place, the right steps are being taken to make sure we do this safely out of the gate. I think having Steve on tonight has been marvelous, because he has clearly laid out what the risks are involved here and what we have to do in order to protect everyone involved from those potential risks. A couple of follow-up items regarding this meeting. This meeting is being recorded. It will be posted on our website. So if you want to review any part of this meeting, you'll be able to do that. We will be doing a follow-up document, which will have all of the questions that we received and their answers posted as well. And if you have any questions, you can contact us at the email address that Reagan gave to you at the beginning for the questions here, info@abbasketball.ca, and we'll be sure to get back to you as well. Also at our office number, 780-427-9044, hit the appropriate extension. We're still taking calls. We're still open for business. So we look forward to these steps as we get going again, and get going again safely. We know everybody's so anxious to get going really quickly, but let's work together. Let's follow the guidelines that are being provided to us, and let's make sure that everybody involved is safe and gets back, and we can keep this thing going and building in the sport of basketball. And thank you all for being part of this tonight.
Thank you, Paul. Again, tremendous evening, great information. We look forward again to our return to basketball. And again, please do reach out to us to ask for more clarity and more information as we roll forward, and we will work with you to make sure that everything is being done properly so that we can return to basketball safely.